everybody. Welcome to another Medical Myths, the show about what not to do with your body. And today is a big one that I've been saving for a while, and I'm sure I will have more episodes on this specific topic because we're talking about chiropractors today, and especially touching on what even is chiropractic. I can't even speak. What is chiropractic? How did it get to this place that it is in society? It is one of the most interesting topics of conversation, especially because, yes, chiropractic is alternative medicine. However, it has transcended the reputation of most other alternative medicine and has integrated itself within what is known as conventional medicine. And this is very, very problematic, as we are going to get into this video. And I'm sure we're going to have some various opinions within the side chat. Oh, and welcome, Fuzzy Logic and Lover of Laughs. Glad that you both made it. This is going to be a good one today. But chiropractic is something that has contention on all different sides of the evidence-based medicine issue. And on the one hand, if you think to yourself, okay, well, what is the harm in allowing somebody who has done a doctorate level program in specifically spinal anatomy, musculoskeletal disorders? What's the problem with allowing those people to set up a practice? And, if people want to seek out chiropractic, then they can. And if you don't want to, you don't have to. Like, what's the problem, right? The problem is that chiropractic, as the number one, comes from non-evidence-based medicine. It comes from supernaturalism, vitalism, a lot of principles that we have abandoned because they have not shown to be useful in predicting outcomes and predicting the realities that we live in. So it's the philosophy is not useful. And in addition to that, we see chiropractors gradually and very rapidly increasing their scope of practice and trying to present themselves as primary care doctors or as musculoskeletal specialist doctors. And there's so much ambiguity for who you're actually seeing. And chiropractors are trained to lobby. They're trained to put on an appearance to their patients, to the government, to try to get themselves as legitimately established in their eyes as possible. And this is causing a lot of issues because when you have Dunning-Kruger leading the way and fewer regulations, that is when people get very, very hurt. So one example I'm actually going to show you real quick before we get into the nitty-gritty of this. But I've talked about Josh Axe on this channel before, and I'm actually going to share, not that one. I'm going to share this Google search real quick just so you get an idea of what I'm talking about. So this is just a Google search of what happens if you look up Josh Axe. It says that he is a doctor. So if somebody didn't know his background, didn't know what he stood for as far as like what he is known for in the community, being like with his ancient wellness, something like that. He has a podcast. He has a massive, massive following on the internet, but it just says doctor. So if you have somebody who talks about healthcare related issues and says the word doctor, what comes to mind? What do you think this person is? And for most people, they would think that this person is a trained and qualified medical doctor, and he isn't. And this isn't even the scariest part because, sure, the word doctor isn't exclusive for physicians, right? There are doctors of nursing practice who are nurse practitioners, and yeah, they have more of an ability to practice healthcare and actually perform duties similar to a medical doctor, but even they're not really allowed to use the term doctor in a clinical setting because it's ambiguous. Of course, you have PhD doctors who are not medical doctors, and they have to be transparent about what their degree is in and what their expertise is in. And if you have a PhD doctor in an emergency situation on an airplane, more than likely they're going to say, no, I'm not that kind of doctor. Do not ask me for help. However, you have these people like Josh Axe, who says doctor here, but also on his Facebook page, it says physician, which physician is specifically a term set aside for medical doctors and doctors of osteopathic medicine, those licensed as physicians to practice medicine in their respective country. And there are some caveats where naturopaths, chiropractors can say physician if they include the specification right before that. If they say chiropractic physician, which sounds really icky when they put it like that, and naturopathic physician, but they by law in most places have to have that specification that they are not claiming to be an MD or a DO. But we see a lot of ambiguity intentionally here with Josh Axe and a lot of people like him. And unfortunately, a lot of these people don't know that they're scamming people. There are a lot of people that go into the field of chiropractic and have no idea that they're not legitimate because they just don't know better. They are taught certain things, and I feel terrible for them, but they are unintentionally hurting people. And it's really, really scary. Yeah, and the audience here talking about vertebral fractures and vertebral artery dissections caused by chiropractors. And yeah, that is part of the risk as well. It's all pretty scary. But let's get into what is chiropractic. How did we get here? This is an article from way back in 1998, but it is from JAMA Internal Medicine. So just kind of an overview of chiropractic at the time, and not much of this has really changed since then, other than some of their predictions have come to pass by now. So they say chiropractic is an important component of the U.S. healthcare system and the largest alternative medical profession. And yes, that is true. Chiropractic's position in society is contradictory, and we reveal a complex dynamic of conflict and diversity. Internally, chiropractic has a dramatic legacy of strife and fractionalism. Externally, it has defended itself from vigorous opposition by conventional medicine. And despite such tensions, chiropractors have maintained a unified profession with an uninterrupted commitment to clinical care. While the core chiropractic belief that the correction of the spinal abnormality is a critical healthcare intervention is open to debate, chiropractic's most important contribution may have to do with the patient-physician relationship, which interesting that they're kind of using this to compare to the physician relationship. But it is true. There are aspects to how we communicate healthcare issues that has unfortunately led to people leaning on alternative medicine, because if you don't have a good answer, you're going to go to somebody who's going to give you some kind of answer. And unfortunately, that works. And it gives these people a lot of lobbying power. And their education is full of entrepreneurial mindset. Like, they learn how to convince people that they're legitimate. They learn how to get people in the door. And medical doctors really do not have a lot of education on how to get people in the door. They're not really trained as business people. So you can see a difference in how they acquire their customer base per se. But and that is part of why chiropractic has ended up the way that it is. Yeah, and Quantos Nachos is getting into an important point here, is what we're going to get into in these few paragraphs. Even to call chiropractic alternative is problematic in many ways because it is distinctly mainstream. Facts such as the following attest to its status and success. Chiropractic is licensed in all 50 states. An estimated 1 of 3 persons with lower back pain is treated by chiropractors. In 1988, so I mean a good long time ago, so I'm sure that this budget has increased since then. between 2.4 and 4 billion was spent on chiropractic care. And in 1990, 160 million office visits were made to chiropractors. Medicare has reimbursed patients for chiropractic. I believe Medicaid also may cover chiropractic. Insurances, like private insurances at large, cover chiropractic. So this is very, very normalized. And as they mentioned here, the number of chiropractors in the U.S. Was expected to double by 2010, whereas the number of physicians was expected to increase by only 16%. So we have a physician shortage, and we have a growing profession of people who think they know more than they do, stepping up to try to fill in the gap. And this is how we ended up here. But chiropractic started as a bone setting philosophy. So D.D. Palmer in 1895, supposedly there's this mystical story of him shoving a cervical vertebra of a deaf janitor in, and somehow like his hearing healed and stuff. There's a lot of debate about whether or not this actually happened or if this was a fabricated story. But there's a lot of supernaturalism in this origin. So basically, it was if like the bones that move, especially the bones in the spine, move and shift. And so whether it be by trauma of the bones, like being misaligned, or muscles getting tight and pulling on different bones and then pulling them out of alignment, all of that was a hypothesis at the time by D.D. Palmer, although hypothesis is a bit of a stretch. It was an intuition by D.D. Palmer because there wasn't any evidence of this actually working at the time. There's no evidence to suggest a causal relationship, even if this did happen, even if this person did recover their hearing after having their bones reset. We don't have any evidence that this actually happened. So it was intuition and not really a hypothesis. But they took this idea, and it was just the same kind of thing as like tooth pulling, as I'm mentioning here. A lot of alternative treatments developed in the late 1800s with this idea that, what if the body can just heal itself if we just make a couple modifications? And getting into this next paragraph too, D.D. Palmer strongly believed in magnetic healing. And I've done a medical myths on this in the past with Godless Engineer, but that is an interesting thing. But he got this idea from magnetic healing where, and here's actually a quote, chiropractic was not evolved from medicine or any other method except that of magnetic. So the idea that you need to improve the flow of energy within the human body, and you do that through magnets to realign this flow. And this idea of the innate intelligence. And this kind of goes along with ideas in intelligent design, ideas within homeopathy, naturopathy, kind of this vitalism idea that the body knows what it's supposed to do, and it's going to naturally do those things unless something is in the environment to not allow your body to properly heal itself. And so apparently by adjusting the spinal bones back into its normal place, you can prevent inhibition of this flow through the nervous system and cause all kinds of different healing. So this is the premise for all of chiropractic. So to say that there are some chiropractors out, and I'm not going to say all chiropractors are out there hurting people, but chiropractic itself is a load of religion. Like, this is mysticism. So to say that anything stemming from that that has not evolved through evidence-based medicine is inherently problematic to be teaching, and inherently problematic to study that and then assume that you're going to have the knowledge to manage whatever issues they're trying to treat. And we'll see examples of chiropractors treating cancer patients and telling patients not to go through chemo. We're going to see some very terrible reading of x-rays. We're going to talk about x-rays. What is the use of them? How can we utilize them appropriately? And all of that. What are some errors in x-ray interpretation, and how x-ray use has become part of the chiropractic scam? Yes, I don't know if we need to go into the rest of this. I'm going to switch over to something else. We'll get into kind of the super sketchy stuff later on, but let's actually look at, not that one. Let's look at what chiropractors are claiming, comparing themselves to medical doctors. Actually, I'm going to show a couple of videos first. Let's do this. Okay. So here's why I care so much. Oh, why it's I'm trying to unmute the video and it's just taking me back through different ones. Okay. Okay, here we go. I'm going to share this. So I have a bunch of short videos from YouTube that I got from this person named Dr. Justin. He is a radiologist. He is a board certified radiologist, and he does a lot of really good reviews of chiropractors, especially chiropractors from a particular organization called Wellness Way. This chiropractor is not specifically from that group, but he also has his own problems. But this is a little taste of why I care so much about this issue.
Fun of the idiots at the Wellness Way. This chiropractor is dangerous. He needs to be stopped.
All right, Dr. Goodbinder here. This is Sue. Say hi, Sue.
Hi.
What are you diagnosed with, Sue?
Breast cancer, stage 1.
Okay, breast cancer stage 1. Now, other than our treatments that we were doing just to help you get healthy, not to treat cancer.
That was a weird disclaimer. Someone asked him what his area of expertise is. He says non-acute functional medicine.
Did you do any other medical treatments for your breast cancer?
No, the only thing I did was what you prescribed for me here. Okay. They wanted me to do radiation.
Yeah, so she had breast cancer stage 1 and went to a chiropractor, and she hasn't done any of the recommendations of oncology. She has just done what the chiropractor has said. So this tells me that this chiropractor thinks he knows enough to tell this woman not to listen to her oncologist. This is incredibly dangerous.
And hormone blockers, which I chose not to.
We did super in-depth hormone testing on her. We're able to change the metabolic pathways.
Super in-depth hormone testing. Like what is that going to do? I mean, you can do some genetic testing for some cancers to identify, is this a tumor that is responsive to hormones? The reason why they want to do hormone blockers is, especially within breast cancer, you could possibly have either estrogen responsive or progesterone responsive breast cancers, meaning that those hormones could cause further malignancy and cause metastasis and cause growth of the tumors. So you take the hormone blockers to stop the estrogen and progesterone from causing the cancer to get worse. And so somebody that has no knowledge of this and is saying that we're just going to reset your metabolic pathways or whatever, which I don't even know what that means. That's just so much of what these people say is just word vomit and word salad that sounds reasonable to people who don't know any better. But these people have no credentials in oncology. And like, you have such an extent of Dunning-Kruger here that is mind-blowing, because if you have a family medicine physician, or you have a pediatrician, like a general pediatrician, or a general internist, or even if you have a surgeon who doesn't operate on cancers, I mean, a lot of surgeons end up doing that, but like, if you have a legitimate physician who does not practice oncology, they're not going to be the ones to tell you whether or not to listen to your oncologist. Like, that is absolutely bonkers. Especially, this chiropractor is not going to take responsibility for whatever happens. Like, let's say this woman had a terrible outcome. He could be sued for malpractice, but the issue is, like, what these people do, and this is why scope creep is such a big issue for me. If someone like him gets taken to court, he's going to say, well, I'm a chiropractor. I'm not an oncologist. I just didn't know better. And he can get off scot-free because he can lean on this being very religious in the approach. And he's saying, well, I wasn't practicing medicine. I wasn't telling them not to do these things. I was just helping them through their religious and spiritual views. And they'll treat this as wellness and spiritualism, to where, like, they can pretend to practice medicine, but as soon as they get called out, as soon as they have to face accountability, they're just going to make shit up about why they don't have to take that accountability. And this is absolutely despicable.
We've done a lot of IVs and a lot of supplementation.
Dr. Gandhi, a neurosurgeon, points out that she is likely cancer-free from the excisional biopsy. He replies he has treated at least 50 breast cancer patients to full remission. He asked, well, that's incredible. Have you published a protocol? He said, unfortunately, he doesn't have the time, but he does have a doctor out of Colorado that is offered to help. Someone asked,
yeah, so they had, so going back, like, right, yeah, so a neurosurgeon is in the comments saying that, yeah, this person probably was, like, in remission from breast cancer because of the excisional biopsy, which an excisional biopsy is a biopsy that removes the tumor and then gets the pathology on it. So probably what happened was this person had a mass, like a breast mass, and they said, okay, we're going to take it out and then biopsy it, like, to see what it actually is. And then the path report probably came back as breast cancer. And since you only had a localized mass, like how we stage cancer is, there's like a TNF grading system. So it's usually related to the size of the tumor, the amount of lymph nodes that are involved, any, like, how much does it extend into surrounding tissues, does it metastasize, etc. So that's kind of how cancers are graded. So the fact that, like, they were able to take out the whole tumor and didn't find anything else scattered around the body, like, and if they got the whole area, that would explain why she's in remission, and that why it would be stage 1. So that's how we get to that. But then, as they just read, the chiropractor said, well, we've had over 50 breast cancer patients that get full remission with our care, and claiming that he has caused with his IV, which, why is a chiropractor giving IV therapy? That's, like, IVs are not benign by any means. And as an aspiring nephrologist, fluids, like, just giving fluids of any kind for no reason, or for just because you think it's not going to hurt, is actually very, very problematic. There's a very delicate homeostasis within fluid physiology. And so just getting IVs for the funsies, or just doing it because somebody's sick, is not a good answer, and is likely malpractice. And being someone who's not a medical doctor, or not a PA, NP, somebody with licensure to do IVs, that just sounds like straight up scope creep and malpractice. But this is, yeah, the fact that if you actually did this, like, imagine if you had this alternative method that actually worked in causing 50 plus patients especially those in stage 4, to be in full remission. Why are you not publishing this? There's this like interesting like contradiction. There's multiple contradictions inherently within the practice of chiropractic, and also just within how chiropractic has evolved, because like one of them that we're seeing in this case, it's the idea that, well, conventional medicine just doesn't want to do any of this stuff because it's too legitimate and they just want to keep you sick. But then they're putting none of the work to actually publish and make their protocol known and actually demonstrate its effectiveness. If you actually had this protocol, if you knew what to do and it worked, and you actually wanted to change the medical system for the better, why wouldn't you allow your protocol to get out there and allow other practitioners to utilize it? This just sounds like it's absolute bullshit. This is like, we have the cure for cancer, but she goes to a school in Canada and you can't actually meet her. So yeah, I was like, okay, do you actually have a cure, or are you just talking out of your ass? And I think that he's talking out of his ass, or just taking credit for the excisional biopsy that oncology or like gen surge, plastic surge, somebody did on this lady.
Someone asked what treatment he uses. He says ultra in-depth labs, IVs to hypercharge their immune system. Incredible.
Hypercharge the immune system.
He replies they do the most in-depth testing in the world.
Yeah, the protocol is we do the most in-depth testing. Okay, so something else here. We need to understand the difference between diagnosis and management. So when we're asking for what your protocol is, that's we're talking about management. We're not talking about diagnosis, right? And even then, a chiropractor is not qualified to diagnose breast cancer. So why is that person doing those labs? Like, that is just a cash grab in that case. But I'll play a little bit more of this and then we'll go to a different video.
Of course, yeah.
So the oncologist gave her news. We are 100% clear there are no irregular cell formations.
What was that word?
No irregular cell formations.
So I just had
Irregular sublimations. What is that? I am so confused. Yeah, so there's that. What else? Oh, here's a funny one. Here's a really funny one.
In today's edition.
Yeah, I don't have to keep sharing the screen because it's already shared on the same page. This is awesome. As someone who went to a school in Canada, 3 of them, I can confirm the cure for cancer does go to school there. Actually, yeah. I mean, one of the cures for cancer is probably access to healthcare. You know, that is something that Canada does have. Also, I forgot, I've been playing with these. I have some more immunity shots. If people want to give super chats, I will be drinking these. These are the turmeric, pineapple, and ginger ones. I have 4 of them today, if we get to that. But here's another one of a chiropractor claiming to have treated a heart attack on an airplane.
Of things that definitely didn't happen, we have a chiropractor who claims to have saved the life of a man having a heart attack during a flight. Now, apparently, 2 oxygen tanks, 5 MDs, 2 EMTs, and 1 nurse were useless during the situation. They gathered around wishing the symptoms would just get better. Thankfully, our chiropractor was there to adjust the patient, quote, removing the interference in his nervous system and saving his life. Now, I'm more inclined to think this is how it went.
Right now, I feel more useless than a chiropractor in an emergency.
Excuse me, is anyone here a doctor?
I have a heating pad in my office. What seems to be the problem?
Remember, you didn't choose chiropractic. Chiropractic chose you.
You were called for a time like this. Yeah, okay, so let's chat a little bit about heart attacks. So let's be real. Okay, if you are on an airplane and somebody has like sudden onset of crushing chest pain, even let's say it's the most like typical symptom presentation, you've got pain like radiating down the left arm, you maybe have some jaw pain, etc. Like, we have a very textbook myocardial infarction or heart attack, what do you think the MDs are going to do other than, so they may or may not have an emergency kit on board. They may or may not have nitroglycerin, aspirin. That is probably the extent of what they have. They may or may not have access to an EKG. So kind of the big thing that they could even do, that anybody could do on an airplane if this happens, is give some aspirin or give some nitro if it's appropriate, assuming that they have an EKG there that they can read before giving the nitro, because we're not gonna bottom out their blood pressure like that if we don't know where the location of the heart attack is. But there's not much that you can do like away from the hospital for a heart attack. Like, this person is going to need a cardiologist and most likely a cath lab. So I don't know what the chiropractor was thinking he was doing by popping the spine. In fact, probably could have made things worse. But does the chiropractor really believe that he could unclog an artery in someone's heart with popping the neck? Like, chiropractors like this really enforce the idea that they have not actually studied anatomy, physiology, anything medicine. Like, there's such a fundamental misunderstanding here where if you know the mechanism of the injury or of the disease process, you know that this sounds absolutely ridiculous. A heart attack is caused by obstruction of a coronary artery. How do they think that this is going to resolve the obstruction of a coronary artery? Like, that just does not compute. Incredibly irresponsible. And we'll get into things where chiropractors claim that they know more than medical doctors, and they claim that they are trained better than medical doctors. And that is all so much Dunning-Kruger. We'll get into those in a minute. Let's get into some of these other videos, because this gets really, really laughable. Which one do we want to watch? There's Dunning-Kruger. Oh, here's another one. Dunning-Kruger effect in action. And we're going to get into some fun X-ray.
I want to show you guys the labs and X-rays of my 38-year-old patient.
So they love to share their labs and their X-rays on TikTok and stuff, because that's definitely, it definitely seems like they're just trying to come across as smart and also trying to get people to go to their clinics or whatever. I do see like medical doctors doing like sharing cases online, but the cases that are shared for medical doctors are usually for the purpose of educating other medical professionals. So it's an educational purpose, and it's not to make you go see them in their clinic. It is for you to understand and be able to manage patients with that kind of presentation. But the way that these chiropractors are doing it is trying to, number one, come across as smart. Number two, bring people in for more back adjustments. But here's what, I think this might be the same guy that was treating the cancer patient. I think this is also Dr. Goodbinder.
I want to show you guys the labs and X-rays of my 38-year-old patient who had thyroid issues but didn't know the extent of her thyroid problem going on.
Wellness way, obviously.
One of the biggest things that's important to identify is the thyroid gland it's a reactive gland.
So, okay. So I want y'all to tell me what the number one issue is with his interpretation already. Like, so he's using this X-ray for a thyroid patient, which question number one, why is a chiropractor treating a thyroid patient? If the main defense for chiropractors is, oh, we're just musculoskeletal people, like if we stay in our lane, it's fine. Well, most of them are not staying in their lane, and treating thyroid disease is definitely not staying in their lane. But look at this X-ray. Somebody in the audience tell me what this is an X-ray of. What part of the body did they X-ray? It's not the thyroid. They did not X-ray the thyroid. This is an abdominal X-ray. And specifically, a lumbar spine x-ray. So these chiropractors baiting people and saying like, hey, in order to adjust your spine, like I need to get this x-ray first. And why are they getting abdominal x-rays? Why are they focusing on the thyroid? And this is going to get more interesting as well. So stick with it.
And so it reacts to the environment of your system. So when you have certain swelling in your intestinal system and your liver's not working quite right,
I want to know how they decided that the liver's not working quite right, because this isn't an x-ray of the liver, number one. And can anyone tell me, so he thinks that this area in the middle is the like right in front of the spine with kind of the hypodense, I guess not even completely hypodense, but like some mixed density areas within the GI regions. That is not inflammation. That's poop. And today's funny joke is we're going to be watching a lot of videos of chiropractors trying to interpret these x-rays and really just finding normal things. Yeah, there is the bum on that, and there's poop right there. We can see a good amount of poop, and that is normal. It's normal to be a human. If you are eating regularly, then you should have poop in your colon. Like that's how that works.
going to influence how your thyroid is interacting with the environment of your body and what it feels like you should have hormonally.
What the hell does that mean? That is a whole lot of words for absolute nonsense. Today I wanted to talk about the Dunning-Kruger effect. It's the idea that people who know little about something overestimate their knowledge and have unreasonably high confidence that puts them there at the peak of Mount Stupid, while actual experts in the subject are aware of what they don't know. Does that sound familiar?
I'm about to show you guys
Here's another
what
one.
massive amounts of
Here's another one. We're just gonna watch all these because this is really funny. So here's another one. Oh, this is part 3 though. Let's go back to part 1 for this guy, or even we'll just go to the top of this little playlist here. Okay. And we'll just go through. So
I'm going to show you the labs and the x-ray of.
So this is a lady. This is different than the person that we just watched, obviously. So she's going to teach us. She's going to do us a teach on real medicine. All right. Stay tuned.
So I'm going to show you the labs and the x-ray of one of my patients that was struggling with non-alcoholic fatty liver.
Which, why is a chiropractor trying to manage NAFLD, non-alcoholic fatty liver? Like, how the fuck is that staying in your lane?
The thing I'll show you are his x-rays, and you can see back here there's so much inflammation built up within his intestines.
So close, Miss Chiropractors. See, this is actually poop. You can't see inflammation on an x-ray. That is poop. That is the lumbar spine.
That's right. You cannot see inflammation on an x-ray. I love just the way that this guy, this radiologist approaches it. It's like, so close, Miss Chiropractor, but that's actually poop. And this is a running series on his channel, and I absolutely love his content so much.
But thank you for trying. Oh, Bryce, you post 2 different...
Oh, and here's we'll get to that one in a second. Here's another one here. This one.
What?
Here we go. This is another part 6. Where do I have these in order? I probably do not have these in order. Oh, here we go. Doctor versus chiropractor. This is the one I wanted. Isn't part 4? I don't have all of them in here. I'm sure there's many more of these, but this is... We'll do whatever order we want. It doesn't really matter.
To show you guys the labs and the x-rays of one of my patients who came in struggling with GI issues. So first thing we actually notice is in the x-ray, you can see all of this GI inflammation.
That is poop.
You can see inflammation of the small intestine here.
Those are farts.
Inflammation of the stomach up over here.
That is the colon at the splenic flexure.
And a lot of backed up stool.
Now, if you need a good laugh, go look at the comments and his replies on all of his videos. Here, someone asked him to cite his sources. He basically replied, "Trust me, bro, there's a lot of research on this topic. Message me and I'm happy to discuss this more." Here was my favorite back and forth when someone said, "More holistic provider, aka you don't accept insurance." He replies, "Correct, and there's nothing wrong with that. We actually don't provide medical care at all. They provide wellness care, which is the true health care."
Yeah, so he got away from that, saying, "Yeah, well, we're not practicing healthcare. We're practicing wellness. So therefore, I can say whatever I want and not have to meet any guidelines because it's literally like all of this with all of these videos. We're just getting into more people just talking out of their ass and saying whatever they think, and not actually having the skills to interpret radiology." Like it is just wild. Like x-rays aren't as simple as people make them out to be. And this is definitely inappropriate uses of x-rays. You don't want to be just giving people radiation just for the lulz. It is harmful, and the more you accumulate, the more harmful it can be. There are very specific indications to use x-rays, and there's a whole set of appropriateness criteria guidelines that you can look through and say, is it appropriate for me to image this particular thing? And I will show part of that as well.
He is getting profound now. Lady said she got her gallbladder removed. She's feeling great. He replies, "Well, if you're really sick with it in, you can definitely feel better, but are you truly healthy?" He's trying to get overly fancy, saying
are you truly healthy if you don't get your back cracked 3 times a week for the rest of your life?
How your body methylates. As this smarter person points out, that doesn't make sense. That's kind of like asking a plant how you're photosynthesizing today. Anyone who calls themselves doctor this much is never a real doctor. Define real doctor. The thing about scams, I love that
he doesn't know what anemia is. That could be problematic.
That they never work long term. People can see scams. We have had growth every single year and more.
He says we're not a scam because people keep coming back to us. Bro, get your head out of the sand. Like, people fall for scams all the time, and this is no exception. Let's go to some more. Let's just see all of these. But that particular guy is very funny because here we're gonna watch another video of him, and he blatantly lies on the internet. And this is really, really funny. But also it's funny. It's funny, but it's also very distressing because people are trusting him. People are trusting him with their health, and they're listening to him. And he believes that he's doing the right thing. And it's wild. But here, watch this one.
"Oh, Bryce, you post 2 different videos. 8-year-old boy with eczema, sleep problems, patient with allergies, itchiness, and mold. You use the exact same x-ray. Did you not think we would notice?"
I'm going to show you guys the labs and the x-rays of an 8-year-old little boy who came to my office with severe eczema. He had rashes all over his eyes. So the first thing we found is right in here, right where that small intestine meets the large intestine. He is really backed up, a lot of intestinal gas and inflammation, and same thing over here. You can see a lot of backed up stool. We can see some stomach inflammation up in here as well.
Just a burp.
I'm going to show you guys the labs and the x-rays of one of my patients who came in with severe and chronic allergies, and it seemed like they were actually x-rays. So first thing we see when we start to analyze these x-rays is a lot of intestinal inflammation and gas buildup, a lot of backed up stool in the system. So something's definitely irritating this person's GI tract.
So no one is going to argue that these are not the exact same x-rays, correct? So what's going on? Answer choice A, he is an idiot and a buffoon. Answer choice B, he is scamming social media, just downloading random x-rays, pretending he actually has patients in his empty clinic. Answer choice C, he is scamming these patients, charging them for x-rays he does not take. Answer choice D, all of the above. Let me know. This chiropractor.
and here's a different guy, I believe. But yeah, this would be illegal here in the UK, where you have a law that limits unnecessary patient exposure to ionizing radiation. Yeah, and that should be the case. That should absolutely be the case. But here's another one of another dishonest chiropractor. And it's funny. So these people, like, I mean, you'll watch this guy and he doesn't know how to even sound intelligent. Like, you'll listen to the way that he speaks, and it's just funny.
Doctor decided to come at me. Big mistake. Big. Huge.
First thing I want you guys to notice is these massive bone spurs.
If you think those are massive, I feel bad for your wife. These are actual large osteophytes off of the lumbar spine. Though I understand that your business practice is lying to patients, getting them worried so that they keep coming in to see you.
This guy came in with severe wrist pain after a car accident. His doctor told him it was normal, okay?
That x-ray is normal.
Absolutely. When we look at the wrist, we're basically looking at a complex structure of 7 movable bones.
There are actually 8 bones in the wrist. Before you try to oversimplify it and say there are 7 movable bones in the wrist, not 8. Just know that you're wrong. Learn to accept the fact that you were wrong. You had multiple radiologists telling you that was a normal x-ray.
Today, we're talking about...
Yeah, and the funny thing is, so this guy, like, he sounds so condescending. Like, he sounds like he's trying to dumb things down for people, but he actually doesn't know what he's talking about. Like, he sounds like a mansplainer. Mansplaining the amount of bones in the wrist. Like, this can't be a normal x-ray because you see it's a complex network of 7 movable bones. And, like, yeah, it's a complex network of 8 movable bones. But you had multiple board certified experts in radiology, like, just in the interpreting scans. Like, that is their bread and butter. And you're gonna mansplain that, no, it's actually this. This guy bothers me so much.
About fitness, and specifically kind of types of fitness, okay? Fitness as an adult, really hard.
Absolutely profound. I have nothing.
I love that. Absolutely profound. I have nothing to... Yeah. Fitness as an adult, really hard. Yeah, okay.
To add. Like Omar from The Wire said.
You come at the K, you best not miss.
But here's the good news. The Wellness Way is hiring.
Yeah, so it's just so funny. What else we have? I'm pretty sure there's another good one. Did we watch that one? I think we watched most of these. Okay, yeah, we did. So that's kind of like a taste of what these chiropractors are trying to say on TikTok and on Facebook and other places on social media. And they legitimately think that they are smarter than medical doctors, and yet they are clearly making mistake after mistake after mistake. And they're also just flat out lying and stealing images from the internet and claiming that the same x-ray is 2 different patients. But let's look at a little bit of the x-ray issue, right? X-rays are not super straightforward. They seem like you can just stand in front of the thing, get the scan, and then just interpret willy-nilly and just make up whatever findings you see. But that's not the case. There's a lot of science that goes into x-rays, and it's important that people are trained appropriately for how to obtain the scans and for how to read the scans. It's something that's hard to learn even as a practicing physician. Like, that's something that takes a lot of time and effort, because there are a lot of things that can mess up the scan or mess up how you interpret it. There's a lot of things that look similar to other things. And so it's important that you have good radiologists who know what they're doing and especially ones that can verify what these smaller practices are doing. I'm pretty sure that if you are going to interpret x-rays in your own practice, that there are regulatory criteria where you have to send off a certain amount of your scans to radiologists to make sure that you're interpreting them accurately. And that verification is very important. But let's look at some basics of x-rays. So, of course, the x-ray comes from, here, if we go to, this is an x-ray tube. You have a lot of physics stuff happen. We're not going to get too in depth on the actual physics of how the electrons are transmitted and how you get these different densities to show up as different wavelengths on the X-ray image. But kind of what we're going to get into is how scans can be a little bit misleading and why we have to be careful about how we're interpreting these scans. So X-rays travel in straight lines. Body parts further away from the detector are magnified compared with those that are closer. So you're not getting accurate representation of every single body part within kind of that. And with that, you have, like, the whole concept is X-rays bouncing off of different structures. And so when you have a wave that bounces off of different structures, if you have an abnormality within those structures, you can get different artifacts that show up that might look like something else. Like, for example, if you have a small airway obstruction due to like a mucus plug or something, you can get a complete whiteout on the X-ray. Like the lung field just looks grayed out or white out, and it's not because the entire airspace is filled with anything. It doesn't mean that there's any pathology throughout the lung. It just means that there's artifacts from the fact that there was something blocking a small airway within there. You get the way the waves travel and the way the tissues uptake the radiation or reflect the radiation differs. And so with different absorption and reflection, you just have a complete misrepresentation of what's going on because of the underlying physics. And so you have to understand why this works and how this works so you get an understanding of, is this accurate? Is the finding I see accurate? Is this normal? Or is this just, or is this something actually serious? Or is this something like, did I position the patient improperly? Which side is the detector on versus the X-ray source, like we see here? So let's say we're getting a chest X-ray and you put somebody in front of the detector, an X-ray source. You have, depending on the part that's closer to the detector, that's going to be the most accurate size representation because you're having the waves bounce off and it's going to detect like right there. If you have an anterior posterior X-ray, so let's say if you are standing facing the X-ray source, so you have the heart in the front, you have the spine in the back. If you have the source towards your front, your heart is going to look a lot bigger because you get that extra magnification from being farther away from the detector. So that's why when we get chest X-rays, we often get posterior, anterior projections because that allows the heart size to be most accurately interpreted. So what does that mean? So as we're getting these X-rays, we have to know that depending on how the patient is leaning, how they're rotated, did they breathe differently that time? That could all give you an inaccurate assessment of what's going on. And you might need to repeat the scan, or you might need to get a different scan. So you might need a CT or an MRI because you couldn't visualize something appropriately. And so there's a lot of nuance in how to do this appropriately. I have some other... Oh, here, we're going to talk about tissue density. So how we get the different colors on the X-ray. So we have the 5 X-ray densities. And so we have air, which is like pretty much all black. We have metal, which shows up as white. And then you have varying densities of tissue, within the middle, kind of ranging between those two. And so this is something that when we were looking at the x-rays that the chiropractors were getting, and we'll look at some normal ones there as well, but air is going to look darker. And if you think about areas within the body that naturally have air in them, that is normal. And it is normal to see some things that aren't air in there as well, like looking at this chest x-ray. And it's cool if I hover over these images, it'll highlight certain things. But we see that we have bone that easily stands out as more like of a light gray color. We have the lung fields, which are pretty dark because they have mostly air. But you do see some kind of like tree branchy stuff within there, and that's normal. Those are small airways and alveoli. It's like we call that like air bronchograms. You see the bronchi, like the bronchioles in there that are the super small airways, the bronchioles, and they have some tissue around them. So the tissue along those are going to have more of a gray color compared to the black color of the lung. So that's something that is normal. If we only saw black in that area and not any of those air bronchograms, I'd be worried that maybe they have a pneumothorax and their lung isn't properly inflated. So the tissue densities are very important to consider. We have here something abnormal where the ribs aren't all present. And so we have an example of some artifact. An artifact is just some type of appearance showing up that is a like there's something else in the picture causing it to look different, like not necessarily an abnormality within the person, but maybe there's a piece of hardware that's present and that's giving off, making another part look different than it normally would on X-ray. So that's what's happening here. Normally you'd have a reflection of the X-rays by the, we'd see density, like hyperdensity of the ribs, and we don't see that there. So we're seeing this section over here with the green, where it looks too light, because normally that there'd be a rib there to kind of reflect that, but we don't have it anymore. So we have differences in how these densities are going to be perceived on those x-rays. So let's look at some, as we looked at some of the chest x-rays, let's look at abdominal x-rays, because that's what they love to talk about for some weird reason. They love abdominal x-rays, which I'm still very confused about why you're getting abdominal x-rays if you're claiming to only work with the spine. Like, yes, you can see the spine on these x-rays, but I don't know why the chiropractors are focusing so much on like the actual GI tract and stuff. I mean, I do know why. It's to sell supplements. Share screen. Here we go. Abdominal x-ray. So this is a normal x-ray, and it looks very similar to some of the ones that we saw from the chiropractors. We have, and if I highlight over it, you're going to see the structures a bit more pronounced. So we have some areas that are less dense. So we call this like hypodensities, but we have poop. This is poop and gas. In the stomach, you see some of the rugae there because it's kind of highlighted by the gas in the stomach, and that is normal. Your body, of course, connects to the air outside. Of course, you take in air even when you eat something. There's some air that's going to get in, and it goes down into your stomach, and the air oftentimes is going to rise compared to any liquid because of density differences. And so there's something, we don't really see it as well in this, but the what the chiropractors were calling inflammation in the stomach was what we call a gastric bubble. That is the gas bubble that would become a burp. It's just the air bubble sitting on top of all the fluid because the density separates those out. So that is normal. And in fact, there are times when an absence of gastric bubble is problematic, and we don't want to see that. So if I didn't see any of this, I might be a little bit more worried. But this is normal. The next one, this also looks very similar to one of the ones, one of the x-rays we saw from the chiropractors, but they were calling all of this inflammation, and no, this is just poop. And this little line here, this is the edge of the psoas muscle. You see that on both sides. The psoas connects to the vertebral bodies and to the iliac crest. And so that's just showing where that muscle is. And you can see this line where that muscle ends. And you see a lot of poop there, and that is normal. Here's another one with some poop and some gas. And these are normal soft tissues. And you can see, as I highlight it, we have the liver, we have the spleen, we have the kidneys, we have more poop, we have bowel gas. So that's a fart right there. That's poop. So this is all normal. So don't believe the chiropractors when they say this is inflammation. You can, like the radiologist was saying, you cannot see inflammation on an x-ray. Like what we can see sometimes, like oftentimes we will use abdominal x-rays like this to assess for severe constipation. And that is something we can say there is a high stool burden or a moderate stool burden. And if somebody has abdominal pain and they have a high stool burden, that kind of tells us, hey, this isn't anything serious. Most likely it's probably just that you need to poop. However, there are times when that could be more serious, like after surgery. Like we want people to be able to poop after surgery, and that could be criteria to let people go home. But we also use this in that to diagnose or at least assess for risk of bowel obstruction. If you see narrowing of a certain part of the colon and you see a large gas buildup to where, like if the intestine is really large on one side and then super narrow on the other side, that kind of tells me maybe there's an obstruction that's causing backup of the gas. But that's not at all what we're seeing here. Because we can see the gas throughout, if the gas gets to the rectum, that means that it made it all the way through the intestine, and that likely there wasn't, at least not a significant obstruction, not significant enough to block the movement of gas throughout the GI tract. So that is reassuring. What else we have? Oh yeah, so here's some abnormalities. So this is a small bowel obstruction. So this, we don't see any poop on it. This is very dilated bowel. So this is exactly what I was talking about with that. Here's another obstruction. So like down here, we see like apart from the big area, we see bowel that looks kind of similar to the previous normal x-rays, but then we see very, very dilated loops of bowel, and that is concerning for a bowel obstruction. Kind of similar thing here. But you can see that there are distinct differences in like how what a problem looks like and what not a problem ends up looking like. And there is something else I want to show kind of on the x-ray topic is this one. So we're going to talk a little bit about quality of x-rays. Specifically, this is quality of chest x-rays. So if you all notice here, this is an abnormal x-ray, but it's very important to know whether or not the x-ray is actually taken properly or not. So if you look at this, we do have some consolidation. So that just means there's something nasty in there, probably infection or fluid or something. This looks like, probably this person has a lower lobe pneumonia. So that is definitely abnormal. However, if you look at the way this person is sitting in this picture, they look rotated awkwardly. The shoulders in the shoulder, their right shoulders, so the one we're seeing on the left side looks like it's higher than the other one, like maybe they're shrugging a little bit. They look rotated, so it looks like it's easier to see some of the lung on the on their left side or right side. compared to the other one. The ribs look a little bit close together. So this looks like how the patient is sitting is not super optimal. And as we were kind of saying before, the way you position somebody for X-ray can misrepresent the size of structures and misrepresent kind of the positioning of things. So that's just something to keep in mind. For this person, it didn't really matter too much because the focus was on, is there consolidation? Yes, we clearly see it. So they didn't necessarily need to do another X-ray. But for teaching purposes, this might be a case where you say, hey, maybe you get a different X-ray so we can actually assess this. This one too, the patient is rotated again. So this is for intubation and ET tube placement. So you can see the structures that you need to see appropriately. So this functioned well for the purposes, they didn't need to repeat the X-ray. But the image quality is poor, like they're saying. The patient is rotated, and there's a wire that passes over the right lung base. So if there was anything abnormal located in that lung base that you needed to see, you do have some obstruction based on that external wire that is on the outside. So just little things here and there. My dad always grumbles when he says chiropractors. He's an orthopedist. Yeah, no, reasonable. Because these chiropractors who think they know how to read X-rays, but are woefully mistaken very frequently. These are just normal chest X-rays. Let's go to, real quick, let's talk about recommendations for when you image for low back pain. So I understand that if you're a layperson and you've had back pain for a while, it can sound reasonable for a chiropractor to get an X-ray so that they're like, the reasons they might give you for why they're getting X-rays are to make sure that you're appropriate to do adjustment on. They might say that it's important to diagnose your issue correctly, even though you cannot, like, the way that the chiropractors use the term subluxation is inaccurate. It's like in orthopedics, the term subluxation means an actual partial dislocation of a bone, or of specifically a vertebral body, and that is a very significant traumatic injury and a surgical emergency. So if you think about it, if the spinal cord travels through the vertebral bodies and you have one of them dislocate or partially dislocate, yeah, there's a huge issue for spinal cord impingement. And spinal cord impingement, especially in a traumatic setting, could be irreversible disability. It is a very, very big deal. And a chiropractors use the term subluxation to mean even just small misalignments of the spine, which is problematic because your spine is flexible. It's got cartilage discs in between. It can move in multiple different directions. It can, if you breathe in and out, it allows your chest to still expand to fill with air and then contract after you exhale. So you have vertebral bodies that are going to shift and move just naturally. And so this is part of the chiropractic scam, though, because if you're sitting a little bit slouchy, they can say, oh man, your spine is out of alignment. And maybe something look not perfectly in alignment, but that's the job of the spine. That's what the spine does. And let's say you repeat the X-ray and you just take a deep breath, or you change the way you're sitting, you sit up straighter, even if you lay down on your back, lay down on your stomach, etc. Your spinal alignment would probably change significantly. So this is a way, it's not a way for them to be honest. For the most part, it is a way for them to say, I can use my intuition to pick out whatever I think looks slightly abnormal and get you to come back for more visits in the future. and make you feel scared that, number one, make you feel scared that you have a problem, which most people have. Low back abnormalities. Low back pain is so common. And a lot of people even have asymptomatic disc bulges in between like L4 and L5. That is super, super common. And so for most people, we don't even do anything about it. If they're not having symptoms, why fix it? Why address it? So it really is a way for chiropractors to sell you something. And even you're going to have to pay for the scan too. So they're just selling you things. But this is an article from the Choosing Wisely recommendations. And this whole kind of public health recommendation plan is about using diagnostic methods appropriately, using treatment methods appropriately. And it's saying, do we have good reason to use this? Or are we just worried that we don't have the right answer? Or are we just fishing around for whatever could possibly be the problem? And so this is how to choose wisely for low back pain. Like what is appropriate to get an X-ray or an MRI or something. So the recommendation is don't do imaging for low back pain within the first 6 weeks unless red flags are present. So there are certain red flag symptoms of like spinal cord damage. They're saying severe progressive neurologic deficits, or if you're suspecting infection, such as osteomyelitis. If there was severe trauma, like if you fell off a bridge and you had back pain, that's a good reason to get an X-ray. If someone's chronically on systemic steroids and even like fall off a couch or something, that could be a reason to get an X-ray. You have to have a good enough reason to do these things. Or like if you suspect cauda equina, which is usually a traumatic injury where you get compression on the part of the spine where it's no longer the spinal cord. It just becomes like a bunch of little spinal cord. It's called cauda equina based on the horse's tail. So it's like a bunch of little nerves that just kind of branch off. And if you compress that, you can get the inability to pee, the inability to poop, or the inverse. You could also get incontinence. You can also get numbness in especially in your inner thighs. And that is a surgical emergency. Somebody has to go in and decompress your spinal cord in that case. So those are reasons to get imaging. But unless you have those red flag symptoms, you don't need to do imaging. Usually kind of the first thing you go with, like you can use some over-the-counter analgesics like Tylenol. You can use Tylenol. You can use lidocaine patches. You can use Voltaren gel, whatever have you. And kind of the recommendation is physical therapy. Physical therapy is great. And there are distinct differences between physical therapy and chiropractic. A lot of the things that people will say are useful within chiropractic overlap with physical therapy. And so those things do work. And if chiropractors just did things like physical therapy, I don't think I'd have as much of an issue. But the fact that they are, number one, putting people at risk for vertebral dissections and also claiming to treat cancer, they are more dangerous than they are worth. So please just go see a physical therapist. And to answer a question from the side chat earlier, on a related note, what do you think of osteopaths in the UK? A lack of prescribing rights is one of the major distinctions between British DOs and American DOs. It depends. I think it depends on how they're regulated and if they're trained the same as American DOs. If they're trained, like as American DOs are trained the same as MDs and go into the same residency programs, the same fellowship programs. So as long as like they're adopting evidence-based practice and continue to regulate their practices with evidence, then I would have no problem, but it all depends on that. So, but yeah, so they kind of get into that. Most patients with radicular symptoms will recover within several weeks of onset. The majority of disc herniations will regress or resorb within 8 weeks of onset onset. In the absence of progressive neurologic deficits or other red flags, there is strong evidence to avoid CT/MRI imaging in patients with nonspecific low back pain. There we go. So, yeah, and here's some more of the red flags. So, neurologic deficits, fever, sudden back pain with spinal tenderness, trauma, cancer, etc. So, and this is something we need to communicate better with our patients about why we're not jumping straight to an X-ray, because it's not going to change management. Yeah, Dr. Mike is legit. He's legit. I'm also a DO, so it's the way that DOs in America work is the same as MDs. So for the most part, there are some scammy DOs out there, and I would treat them in the same way that I do chiros. But at least they have more training than chiros with regard to these other medical things. I do want to get into another video, and this is from a chiropractor, and I actually greatly appreciate this person because this person seems like he's staying in his lane. I still don't agree with chiropractic as a philosophy in general, but this guy actually says some good things. So I'm going to play this.
I need to be careful with chiropractors on social media.
Did you know chiropractors spend more time studying than medical doctors in 7 of the 9 required preclinical instruction subjects?
Nope, we chiropractors do not. We left out the 3 to 7 year residency we don't have to do, the academic requirements we don't have to meet, admission tests we don't have. Take it from someone who went to medical and chiro school. We don't have the training to be primary care physicians. We don't have the evidence to treat what they treat. Good chiropractors stay in their lane. Instead of playing medical doctor, they stick to musculoskeletal stuff like back pain. Instead of sharing fake charts to look smart, they share guidelines to help you stay away from bad chiropractors. Instead of luring you in with cheap x-rays and scaring you with the results, they use x-ray when it's medically appropriate. Instead of cracking your back 3 times a week forever, they give you self-management strategies like exercise, teach you to take care of yourself. Instead of making you feel so fragile that you fearfully avoid using your body, they make you feel resilient enough to get back to doing the shit you care about.
Yeah, so that's another thing that it's the other kind of big contradiction within chiropractic, this idea that, well, we're not curing the body, we're not doing medicine to the body, we are allowing the body to heal itself because the body is resilient, the body can knows what it needs to do and all that. So they take that kind of approach, but then they also believe that you can get all these different problems because your spine is slightly out of alignment. If your body is so resilient, why is your spine constantly giving you problems? And why are small misalignments causing you to get all of these different diseases, including like heart attacks, thyroid issues, etc.? Like, is the body really that resilient then? Is it really that resilient if the small things are causing so much trauma and requiring you to get your back adjusted that many times? It just seems like those are contradictory ideas. I do want to share this article now. So this is from chiropractors claiming to have better education than medical doctors. I appreciate that chiropractor at least being honest about what they are trained in and what they aren't. And it's true. Like, thinking back to the TikTok chiropractor who mansplains everything and didn't even know how many bones are in the wrist. Like, they don't have an entrance exam to get into chiropractor school. You can legitimately have a below 3.0 GPA and no entrance exam. There's no MCAT, no GRE, nothing like that to get into a chiropractic school, and you're going to pretend to be doctors. You have people that are not going to be able to handle that kind of responsibility and not going to be able to handle that kind of academic rigor of a medical program. And you're saying we are equal to them. we meet none of the same criteria, we meet none of the same standards, but we can say similar words, and therefore we are equally valid. And so they're talking about chiropractic physician, which is the language they use is so scammy. This postgraduate program typically takes 4 or more years of dedicated graduate level study in anatomy, microbiology, radiology, which you'll really think you get education in radiology after all those chiropractors can't even figure out what poop is on an x-ray. Like, we can do that in medical school. Come on. Functional kinesiology and chiropractic care principles and philosophy. And then they take a chiropractic board exam. So they have like one exam that they ever, like one standardized exam they ever take. So on the flip side, so I took the MCAT to get into medical school. I actually took the MCAT twice because the first time I took it before I took biochem, and that was an absolute mistake. So I took that twice. But the MCAT, and then I've taken 3 licensure board exams. So there are 2 kind of series of exams, and they're pretty much similar, just slight differences between MDs and DOs. And there, for the MD, it's the USMLE, and the DO one is the COMLEX. And there are 3 levels of the COMLEX, or 3 steps of USMLE. You take one after your second year of medical school. You take the second one after your third year of medical school, and then you take the third one after your intern year. And those 3 are required to be a licensed independent practitioner, a licensed physician, before getting board certified. So oftentimes you need to have those before you become a senior resident, so that you can moonlight, you can manage a team of interns. So you're already 4 exams, 4 standardized, and it's even more than that for standardized exams, because on your clinical rotations in medical school, you have, for each core specialty, you have a standardized shelf exam that you have to take to show competency in each of those fields. So like after your month of OBGYN, you do your OBGYN shelf, you have your surgery shelf, your family medicine shelf, etc. So you have a ton of standardized tests to get through to become a medical doctor. And then on top of that, you have your in residency, you have your ITEs, or the in-service training exams that show, are you meeting the standards of your residency program? And then how likely are you to pass the board certification exam? And then after that, you have the board certification exam, and then you have to recertify that every 10 years. So you're already at least like somewhere between 10 and 20 standardized exams to be a board certified medical doctor or osteopathic doctor. But chiropractors don't have, like, they have one exam after the chiropractic program, but they can have a below 3.0 GPA, and it doesn't matter. They're allowed to get into the program. And I just love the way that these people describe this. So, a medical doctor is a licensed physician who has graduated from an accredited medical school. Their postgraduate education also takes an average of 4 years to complete, and includes courses in pathology, anatomy, biochemistry, medicine, chemistry, statistics, and calculus, among others. After graduation, medical doctors must complete a residency of 3+ years under the watchful eye of more experienced professionals, and oftentimes go into fellowship training as well. So some are between 3 and 7 years for residency, plus another like 1 to 3 years for fellowship, for non-surgical fellowships. I don't know how long surgical fellowships are, but they say medical doctors are physicians that typically specialize in a certain field, such as cardiology or oncology, which is true. It's funny, they tell them, like, they say that medical doctors often prescribe medication and carry out surgical procedures. So they think that chiropractors are medical doctors, just without the pharmaceuticals and surgery. And they also claim extensive clinical training, which, again, no residency. There's no residency involved, no fellowship. Medical doctors go through at least 2 years of clinical coursework, actually in the hospital setting, in primary care settings, in labor and delivery, in surgery. They are doing an insane amount of clinical training. So, like, a physician will graduate all of their training with somewhere between 12 and 15,000 hours of clinical training, compared to what if chiropractors don't go to residency and they just do their clinical coursework in chiropractic school, and it's only with chiropractors. That's what, 500 hours at most. Compare that. So extensive clinical training is maybe 500 clinical hours of just chiropractic, when medical doctors have 15,000 hours. These are not the same. And they say they're going to go into some of the similarities. Medical school is similar to chiropractic school in the first 2 years. I don't know if I believe that, because if chiropractors can't even identify poop on an x-ray and think everything is related to inflammation, we're not learning the same anatomy and physiology. We're not learning the same pathophys. We're not learning, they're not learning pharmacology at all. They're not learning microbiology. Because they need to absorb the information, for instance, microbiology. I don't think that they're actually teaching doctorate level microbiology. Like, and this is a thing that chiropractors will do. Chiropractors, when they talk about this particular topic of, like, they will relate it all down to classroom hours, which could be completely meaningless, because that doesn't really describe the rigor of what the degree is actually doing. Like, for example, if we say that, like, if somebody's taking 15 credit hours of 15 credit hours of an undergraduate class or undergraduate classes, and a doctorate program is giving like 5 to 6 hours of coursework, that's not the same amount of hours. Like, graduate classroom hours, like, you're going to get a lot fewer classroom hours in graduate school, but the rigor is going to be a lot higher. So even if you're taking maybe if you're taking a 3 credit graduate class, that's going to be a lot more of your time than a 3 credit undergraduate class. And even if it's the same subject matter, like, undergraduate anatomy is a lot easier than medical school anatomy. Medical school anatomy fails people very consistently. It's one of the hardest things I've ever done. And I aced my undergrad anatomy and physiology so easily. Like, these are not even comparable. So yes, you're covering possibly some of the same subject matter, or like the same subject, like the same core subject, but the rigor is not at all the same. And this is the same thing that I try to communicate within differences between like PA and NP programs compared to MDDO programs. Not saying that they are like worse providers. They have, like, I love APPs and the work that they do. They do some amazing work. There is a sacrifice, though, for the fewer years of training, that you're going to get a more surface level education than somebody who has a lot more education, a lot more in-depth education on the subject matter. And that's why we need to have team-based dynamics in the medical field. That's why we have physician and APP teams and physician and nursing teams, because they all do different things to different depths and different degrees, and that is okay, and that is great. What we shouldn't do is have our different fields of knowledge and say that because of an arbitrarily assigned number that you're more qualified than somebody to manage cancer patients because you took more credit hours at a chiropractic college than an oncologist did. Like, that is ridiculous to me. That's absolutely ridiculous. And kind of the last thing that we're going to leave off on, I know normally this is the time that we'd end, but this is important. I mean, we mentioned I'm not going to go to the article about the vertebral artery dissection because, you know what, I think it's actually included in this other article I have. So we're going to do this. So this is an older one. This was published in the legal aspects of medical practice way back in 1979. So this is old, but chiropractic training has been in the works for a long time. So this is still applicable. So it's called Malpractice is an Inevitable Result of Chiropractic Philosophy and Training. And I would agree with this because if you think about all of the examples we've had, if your field is rooted in mysticism and non-evidence-based practice and it's based on intuition and making things up as you go along, and the same kind of thing that RFK Jr. is doing, where he's trying to find the proof for a conclusion that he already had, like that is a form of bias. There are a lot of different types of bias that heavily contribute to medical malpractice. Some of them that we see a lot in this is like anchoring bias and confirmation bias. I'm sorry if you hear my dog screaming out in the hallway, but confirmation bias, that you already think you have the conclusion, so you're going to try to prove what you already think. And that is what chiropractic does with their so-called evidence. They will do these studies to validate that chiropractic works. It's like, but why didn't you do the studies before you became a chiropractor and instead are doing the studies after already believing that chiropractic works? Another important bias to think about is, what was I thinking of? My brain just lapsed for a second. I'll remember my train of thought in a second, but different types of bias that lead to medical decision-making errors. And so if your fundamental training is so rooted in decision-making errors, how can you expect to be a responsible and safe clinician, even if your intentions are good? It is inevitable with the training that you give. And so it's important to have appropriate evidence-based training so that the people that you're sending out into the workforce know how to think through a problem. Oh, the one I was thinking of was premature closure. This idea that you're not going to continue investigating because you've already decided what the answer is. And that's the case with these people with their x-rays. They already decided that it was inflammation. And so if you have somebody that comes in, they said nobody else could explain this condition, they say, oh, I think that this has inflammation on the x-ray, therefore that's your problem. And then you stop looking for other options, and then you stop thinking. And we're going to see that in some of these cases. So the time frames, of course, were way back in the day, so I'm just going to read it as is. But 47-year-old man consulted a chiropractor for severe leg pain of 3 days duration. The chiropractor did not remove the patient's trousers, shoes, or socks. Instead, he only examined his back, diagnosed lumbalgia, which is just a catch-all term for lumbar pain, and manipulated the man's spine. 3 days later, when the patient's pain persisted, he finally consulted a medical doctor who realized that the problem was a blocked artery that had been cutting down the circulation of blood to the leg. Had the problem been diagnosed earlier, surgery could have removed the block. By this time, however, amputation of the leg was necessary. So this was a big clinical miss. So this is a case of premature closure where they decided, I know what this is. We're just going to not investigate further. And it cost somebody their leg. At first glance, this might appear to be an extreme or isolated case of malpractice, but my experience as a chiropractor, so this is a chiropractor who wrote this, and as an independent consultant in malpractice cases had to convince me a lot. The chiropractor was merely following what he had learned in school. Chiropractic is based on a false theory. Its practitioners are inadequately trained to diagnose it, and most do not know their limitations. Malpractice is an inevitable result of these circumstances. We went through kind of the chiropractic philosophy before. Are chiropractors trained to accurately diagnose and refer? In my opinion, the answer is no. So he's getting into the straight schools versus the mixer schools. So the straight schools go purely off of D.D. Palmer's philosophy, and the mixer schools are kind of a mixture of D.D. Palmer's philosophy and kind of newer alternative medicine stuff. So chiropractic students, past and present, have not been taught by skilled medical diagnosticians. They are legally barred from using many diagnostic tests that could be crucial to proper medical investigation, nor are they able to study the care of patients in the hospitals. Yeah, so their clinicals are done in chiropractic practices. They're not seeing what can happen when things go bad. They're not seeing poor outcomes. When there are poor outcomes related to chiropractors, they're going to see a medical doctor. They're not seeing a chiropractor. So you can get this inflated sense of ego and think, I have all these really positive outcomes. And that's not because you have positive outcomes. It's because you're not seeing the poor outcomes. This is the same thing that happened with COVID when chiropractors were saying that, like they're making the claims that, well, I don't have patients on ventilators from COVID in my clinic. Well, duh, you don't. Because since when are chiropractors managing ventilators in the clinic? They're not. So that's a problem. But who are managing the ventilators? The ICU. And so the ICU, of course, is going to have worse outcomes because that's where the sickest people go. So they use that logic to say medical doctors are bad, hospitals are bad, people die in hospitals, don't go to the hospital because you'll die. Well, no, you have to think about the logic and the statistics of what is causing that number to go up of those cases. It's because all of those poor cases go to that place and usually go to that place first. The people that are going to chiropractors usually have very minor issues. And so rarely do they ever see something that is truly abnormal. And then getting into the fact that they are not able, they do not adequately prepare their students to function as primary physicians. Yet they tell them they can be, but they don't train them as that. And with that, they don't have primary care physicians teaching them to be primary care physicians. Since chiropractors are licensed as doctors, most people who consult them expect to be properly medically diagnosed. Patients also assume that if their problem is beyond the scope of chiropractic, they will be referred to an appropriate practitioner. However, the problem again is that you have chiropractors who don't know how to accurately diagnose and don't know when they need to refer because they just don't know what can go wrong. So since these assumptions are usually incorrect, the more the patient relies on the chiropractor for his diagnosis, the more vulnerable this person will be. So this is exactly why I do not like this practice. There are two main types of chiropractic malpractice. Number one, the failure to diagnose conditions that require timely medical attention. And two, damage from manipulation of body parts that have been weakened by disease or previous trauma. And here's some of the cases. A 58-year-old woman consulted the chiropractor for low back and left hip pain. The chiropractor performed a cursory exam and x-rayed only her lumbar spine, diagnosing lumbar nerve pressure syndrome. He manipulated her low back area with her left leg flexed. The patient's problem was actually a fractured hip, which you use an x-ray. If you're going to x-ray, why not x-ray the part that hurts if they got hip pain? And didn't do an appropriate exam of the area and ended up like flexing the leg that had the fracture in it. Yikes. Manipulation disturbed the fracture and made normal healing impossible. As a result, the patient required surgical implantation of an artificial joint. So can't even identify a fracture, yet they claim to be better trained in radiology. Yikes. A 38-year-old man who consulted a chiropractor for low back pain was x-rayed, examined briefly, and treated with spinal manipulation. Despite 3 months of treatment, his pain persisted, and he consulted the second chiropractor who treated him in a similar fashion. When his pain persisted, he went to a medical doctor who ordered tests that led to a diagnosis of Hodgkin's disease, which is cancer, that are talking about Hodgkin's lymphoma. The patient's pain had been caused by swollen lymph nodes. It disappeared with treatment of his underlying disease. Yeah, and like something else that is important to think about as well, there are a lot of cancers that do metastasize to the spine, one of them being prostate cancer, which is why if somebody has evidence of prostate cancer, we get specifically like a PET CT of the spine, or you can even get an x-ray of the spine, and if you see lytic lesions, like you see bone breakdown in the spine, oftentimes we think that that is prostate cancer. So that's something that is a very, very important, must not miss diagnosis. Here's another one. So it's kind of similar to the cancer vein. A 58-year-old man with back pain became paralyzed from the waist down after spinal manipulation by a chiropractor. Unknown to the chiropractor, the patient's spine had been weakened by metastatic bladder cancer. The chiropractor's evaluation did not include a medical history, orthopedic evaluation, or a UA. An x-ray film was taken, but was of such poor quality it was diagnostically useless. Yeah, so can't even get a proper x-ray. A 50-year-old man required surgery for a prolapsed lumbar disc that was ruptured by chiropractic treatment. Careful orthopedic evaluation would have indicated that what the patient needed at the time of his chiropractic visit was not manipulation, but bed rest and traction. A 63-year-old woman who relied on chiropractor to treat her for neck pain, headaches, nausea, and dizziness died as a result of brain hemorrhage. Unsuspected by the chiropractor, her symptoms were caused by high blood pressure and urgent need of medical management. 55-year-old man who consulted the chiropractor for pain in his mid-back, chest, and left shoulder was told that his pain was nerve pressure from a spinal subluxation. His problem was actually a heart attack requiring immediate hospitalization. Yeah, so the medical doctor was the one who treated the underlying cause. Yeah. Wild how the people who claim to treat the root cause and not just the symptoms are the ones missing what the actual root cause is and causing people to die. And so here's an interesting statement about like how these prosecutions would go down. So a Pennsylvania chiropractor is now facing prosecution, and by now, this was like in the 1980s, is now facing prosecution for advertising that intense, fearful, constricting chest pain is a reason to see a chiropractor. Absolutely not. Do not do this. Other ads figuring in the case claim that blurred vision is a reason to see a chiropractor, and that pinched nerves can cause abnormal blood pressure, hay fever, sinus trouble, arthritis, pleurisy, glandular trouble, goiter, bronchitis, colds, as well as stomach, liver, kidney, and gallbladder problems. At the preliminary hearing, a medical cardiologist testified that severe chest pain could represent a heart attack. And something too, do these people know how to use an EKG or read an EKG? Because I'd love for them to demonstrate that knowledge. That would actually be really entertaining. I want to see some of the Wellness Way chiropractors try to read EKGs. I would laugh very hard. So here's how the testimony went down from chiropractors when they were asked how they would manage this particular case. So like in medical malpractice claims, you have to prove that the practitioner acted in a way outside of what their peers would normally do. So your peers have to find that your actions were reasonable for the situation. And if you can do that, then it's kind of like, hey, sure, this is harmful. It wasn't necessarily malpractice. Maybe the guidelines need to be updated because a lot of people are doing the same thing that ends up hurting people. But if you practice in a way that is outside of what your peers normally would, that's suggesting, hey, maybe you are not up to date on your field of expertise, and probably it was your malpractice that caused the injury. So here they have multiple chiropractors that come in and they're comparing how those people would have treated this same patient. So they have question and answer format here. Sir, if somebody came to you complaining of blurred vision, would you examine the eye? And they answered, I would examine the spine. I examine everyone's spine. If someone came to you complaining of goiter, would you examine the goiter? I would examine their spine again. If someone came to you complaining of intense pain in their chest, radiating down the left arm, would you examine, or would you attempt to examine the heart by using an electrocardiogram machine? I only check the spine for vertebral subluxations. Would you use a stethoscope to check the heart pain at that point if somebody came to you with their complaint? Like, no, we would not do that. So yeah, all of them basically said, no, we would not actually assess the issue. We would just treat the spine. At a subsequent hearing, the chairman of the Pennsylvania State Board of Chiropractic Examiners and faculty members from 3 of the nation's 13 chiropractic colleges at that time endorsed the ads as accurate and representative of what is taught in chiropractic schools. So take that. So if that is what is caught, and I think there's something interesting here too. So if you have the scope of chiropractors and what they are and aren't allowed to treat, like they aren't allowed to practice as medical doctors, you're saying that you're not teaching them to be medical doctors because you don't want to be held legally responsible for teaching them to work outside of their scope of practice. So you're going to say stuff like this, but then you're going to be in the school teaching your students none of this. You're not teaching them how to be medical doctors, but you're going to tell them that they can be. They can just act like medical doctors, and that's good enough. So all that is like really, really, really scary. And so what needs to happen here is we need chiropractors to at least start being like the one that we watched that was honest about their scope of practice. But I also don't think that that's enough. Chiropractic needs to adopt evidence-based medicine. They need to actually investigate their claims. They need to get rid of all the things that are not evidence-based and only practice what is evidence-based. And they need to have enough knowledge and enough penalties for going outside of their scope of practice to know when to refer to somebody else, and that they should not be as confident as they are with the practice in medicine. So I know we went a little bit later today, but this is one hell of a topic. We're going to get into more of this in the future, I'm sure. I'm sure we're going to have more episodes on chiropractic. If you have suggestions for other topics to discuss on this show, we're live every Saturday. Put your comments down below. Let me know what you want more of. Any particular claims you want me to go over, and any particular fields such as naturopathy, homeopathy, etc. Give me your suggestions. Thank you, everybody, so much for joining us, and I will see you all next time.